Sharon, what happened to make you come to PT?
Well, before we moved to Brattleboro, we were squeezing in a ski vacation at Loon, and I had a little mishap. I was turning to follow my husband down the hill, and I ran into a sign that said slow. So, fell forward, and my shoulder went out, popped forward, out of the joint. So I had to be sledded down the mountain by the ski patrol, and this way. So what happened was I had to go to sleep and have my shoulder pop back in, and so now it's been 2 months of rehab, and I'm getting there. It weakens the joints, the range of your motion is so limited, and I'm still not able to keep my elbows in my body.
Then at rest. Nice. Good.
So what happens is you stay in a sling for a while, but then after you're guarding it, you're keeping it in, and you're afraid to go out.
Right, afraid to move it.
This is the hardest, this would be the hardest motion now.
Right, it's important initially to let it heal so that it doesn't dislocate again, and then do gradual strengthening and
so
work
2
on
weeks
range
in
of
a
motion.
sling. I had 2 weeks in a sling, and I honestly didn't want to give up the sling because I was afraid.
Right, and that's very common. Okay,
Yeah.
so then now the next thing I'm going to have you do is to do the diagonal
Right.
patterns that we've been working on. And again, you're going to need to start with plenty of slack. Only go to the point of...
Do you have a favorite thing about the PT department here at BMH?
Well, I have, as I was telling you before, I have been to PT at some really fantastic places for other things. I had a wrist injury, and I went to Newton Wellesley Hospital where we lived. You can feel that. And they were quite impersonal. They barely laid hands on you. Just sent you home with a sheet of exercises, and that was it. And
That looks good. Rest when you need to.
Okay, the full extension there I can feel. So that was not a positive experience, and I found I didn't want to keep going. I just figured I could do it myself. And the other place I went was down, also in the Boston area. It's a place where the Celtics actually train. And it was such a hectic, busy place. It was not as clean. It wasn't as organized, and it wasn't as on time. So all those things are so great here. Everybody's personal, everybody's on time. They don't let you forget your appointment. If you cancel an appointment, they ask you why. What can I tell your therapist? You know, that's what they ask you. The front desk, if I cancel, says, what can I tell you? So they keep you on it. They don't let you slip away, and that's been important too.
And your therapist is Jerry Lynn. Say hi, Jerry Lynn.
Hi.
How long have you been at BMH?
I've been at BMH, I just had my 26th year anniversary at the end of May. Came here right out of school. I had done a clinical internship here, and I liked the setting very much. I like the small community hospital feel and how much communication we have with the physicians. You don't wait weeks to hear back from a physician. They're very prompt in getting back to you if you have a concern about a patient. Often we have the luxury of going across the hall if we have an orthopedic patient with that practice, and grabbing the doctor if we have a concern, and sometimes they can pop over, or their nurse if we want them to look at their wound or that type of thing. So it's very convenient for the patient, it's convenient for us, and it's been very helpful that way.
Great. Thank you both for letting me document a little bit of your story. There's Sharon
You're welcome.
and Jerry Lynn.